Hi, my name is Paige Greenawalt, and this is my presentation on the advanced assessment technique of using a MOCA test. The MOCA is also known as the Montreal Cognitive Assessment. It is a comprehensive screening tool that can be used to detect any early signs of cognitive impairments. This can be things such as dementia, Alzheimer's, and it can also be used as a routine screening tool on older folks over the age of 65 at routine wellness visits. It tests different areas of the brain, such as visuospatial ability, name recalling, memory, attention, language, and orientation. This can be used in both the inpatient and outpatient clinical settings. Again, outpatient for routine physical exams, or inpatient if there is an acute change in cognitive function. Some potential clinical scenarios that you would see this used on, we kind of already covered. Again, a routine screening tool for the physical exams, but it can also be used in any of the following situations. If the patient or a family member is reporting forgetfulness, if the client is presenting with disorientation to time or place, if there is any new onset of language difficulty or problems completing familiar tasks for them, and also in post-stroke clients, clients with mood changes that can be indicative of a cognitive decline, if they're becoming more aggressive or more impulsive, and clients who have chronic conditions or traumatic brain injuries will also often receive this test just to track their progression over time. Those chronic conditions would be things like Huntington's disease or Parkinson's disease. The physiological landmarks and techniques used during the MOCA test, it primarily obviously focuses on a person's cognitive function and ability. But with this, it is assessing different areas of the brain for changes in brain function. These are outlined on this slide, such as the visual attention function of the test would be assessing the frontal lobe. The visuospatial abilities would be the parietal and occipital lobes. Language and name recall tests would be the temporal lobe, and attention would be the prefrontal cortex. All right, so I did complete this assessment on a patient. I'm going to go ahead and pull that up at this time for us to watch and see how it is completed, and then we will talk about that video further throughout this presentation. Hi, my name is Paige Greenawalt. I'm here with my patient today, and we are going to be completing the Montreal Cognitive Assessment, also known as the MOCA. This is what the document looks like. I know it's flipped for you guys, but it is a test that checks for any changes in cognitive function by testing multiple areas of the brain, including the frontal lobe, the temporal lobe, and the prefrontal cortex. We will get into the normal and abnormal findings once we finish this actual test, but we're going to go ahead and get started right off the bat. So the first section checks for visuospatial memory. I'm going to have my patient start, and I will show you her results once we're finished with the first section. All right, so there is an example on here. It says number 1 goes with letter A, so if you could just complete the rest of the lines connecting the numbers with the letters that they belong with. All right, my patient did well on that section. We're going to move on to the next in the same visuospatial. If you can go ahead and copy the picture of the cube, just draw yours right underneath the one that's there. Wonderful. And in the next section, you're going to draw a clock. You're going to start with putting the clock there and labeling the numbers, and then I'm going to have you set the time for me. If you could set the hands to say the time 10 past 11. Wonderful. All right, so that first section is completed. My patient did all of those correctly, so she's going to get a full 5 out of 5 points in that section. The next one is naming recall, just to see if they can identify familiar objects. So I'm just going to point to the animals and have my patient name them.
Lion, rhino, camel.
Okay, so that is a full 3 out of 3 points there as well. The next section is for memory recall. I'm going to give my patient 5 words. She's going to repeat them to me right away. And in about 5 minutes, we're going to go back and have my patient tell me those words, see if she can remember them. Your words are going to be face, velvet, church, daisy, and red. Could you repeat those to me?
Face, velvet, church, daisy, and red.
Perfect. All right, hang on to those words. We're going to go ahead and check again in a couple of minutes. All right, this next section is just for attention, checking her attention. So for the first problem here, I'm just going to say a list of numbers, and I just want you to repeat them to me exactly how you hear them. 2, 1, 8, 5, 4.
2, 1, 8, 5, 4.
Perfect. And then in this next section of numbers, I'm going to tell them to you, but I want you to repeat them to me in the opposite direction, so backwards. 7, 4, 2.
2, 4, 7.
Wonderful. This next one, I'm just going to read a list of random letters. Every time you hear me say the letter A, I just want you to tap the table with your hand. F, B, A, C, M, N, A, J, K, L, B, A, F, A, K, D, E, A, J, A, M, O, F, A, B. So my patient only missed one of those. She just did an extra tap when it wasn't needed. So no points are taken off if there is less than 2 errors. So she got the full points for that section. And the next one is just a little bit of math. So starting at the number 100, if you can subtract 7, what number does that give you?
93.
Okay. And 93, subtract another 7.
86.
86, subtract another 7.
79.
79, subtract 7.
72.
And 72, subtract 7.
65.
Wonderful. She got all of those correct, so that's a full 3 points there. The next part is language, so just making sure that the patient can speak in clear sentences. I'm just going to give you a sentence, and I want you to repeat it to me the same way that you hear. I only know that John is the one to help today.
I only know that John is the one to help today.
Okay. And the cat always hid under the couch when the dogs were in the room.
The cat always hid under the couch when the dogs were in the room.
Okay. And the last section for the language portion is setting a timer. My patient has 1 minute to name as many words that can begin with the letter F. We're going to go ahead and have her do that now. And I'm just going to set a timer on my phone so that we are ready. Okay, start whenever you're ready.
Face, Frank, finger, feet, fur, Friday, friend, fruit, funny, freeze,
You have about 40 seconds left.
friends,
About 30 seconds.
my mind is blank right now.
It's okay. You have 10 seconds left.
Fun, fish,
Okay, and time is up. All right, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Perfect. So for that section, the patient needs to name more than 11 words, and as long as they do, they get the full amount of points. All right, so this next part is just abstraction. We just have you name the similarities between two items. An example that I can give you is a banana and an orange are both fruits. Can you tell me the similarity between trains and bicycles?
Transportation.
Okay. And the similarity between a watch and a ruler?
Numbers.
All right, so here's the time that I'm going to ask you to repeat those 5 words that I gave you earlier. As long as you do not need any clues, you get the full 5 points for this section. Whenever you're ready.
Vase, velvet, church, daisy, bread.
Wonderful. If she does need cues, that is 1 point taken off for that section, but she did great, so she gets the full amount of points. And the very last section is orientation. So can you tell me what today's date is?
The 18th.
Yeah. Can you tell me what month we're in?
June.
What year we're in?
2025.
All right. What day of the week is it?
Wednesday.
Okay. And what place are we in currently?
My home.
Okay. And what city are we in?
Lancaster.
All right, so full 6 out of 6 points. One thing that we did skip over is asking the patient their educational level. So that is very important with this test because patients with less than 12 years of education get an additional point. What was your educational level?
High school.
Okay. All right, so this is our completed MOCA. I know it's hard to see, but my patient only missed 1 point, and that's when we were doing the letters and having her tap the table. So she got a 29 out of 30. That's a perfect score. So going back to the normal and abnormal, if the score is greater than or equal to 26, that is considered a normal test. Less than or equal to 26 would be an abnormal test, and in that case, the patient would be referred to a neurologist for additional cognitive testing to check for anything such as Alzheimer's, dementia, Parkinson's. People with Parkinson's usually get these tests pretty regularly just to check for decline over time, as well as people with a traumatic brain injury will get these tests pretty regularly as well. That's pretty much all that involves. So if you want to finish watching my PowerPoint and me explaining that, that just goes further into depth about when we would use the MOCA and where it can be used in healthcare. Thank you. Okay, so we took the time to watch that video. As I am getting close to the time allotment that I have on recording this PowerPoint, I'm going to cut the video off here, and I will be submitting a second link to the second half of my PowerPoint. Please keep an eye out on the Dropbox for that. Thank you.